heart of everything we do. We want the views of local people to help shape services and improve health outcomes for the population of Dorset. In April and May 2014, ophthalmology patients and carers in Dorset took part in a series of focus groups, telephone interviews and postal surveys. We have listened to and reflected on what you said. One key theme that came out from your feedback was about care closer to home. A service specification has been written and recommends a service that is accessible, offers flexible appointments including weekends and evenings, and is provided at a choice of community locations. You felt that continuity of care, seeing the same person for your ongoing treatment and monitoring, could be improved. Providing care closer to home will help to address concerns of continuity. And lastly in this feedback was that of information. A patient and carer ophthalmology reference group is being set up, which will be consulted on an ongoing basis regarding service changes, including information provision. You said, we did.
Hello, I'm David Haynes, a GP here at Swanage Medical Practice. I also represent Purbeck on the Dorset Clinical Commissioning Group. I see living in Purbeck as a privilege. It's a very special area with a beautiful physical environment and very strong communities. The population of Dorset has the longest life expectancy in the country. Here in Purbeck, as well as our ageing population, a high proportion of our patients are coping with long-term illnesses.
I'm Alistair Ward, GP at Wareham Surgery and lead for clinical commissioning for that surgery. As David has mentioned, changes to our population means that we need to build a health and social care system that can meet all our needs. We believe that despite the clinical and financial challenges that the NHS is facing, we can still have great healthcare close to home for our families, friends and community.
And as a team, David Haynes, Alistair Ward and I, we've attended lots of local groups and events to talk regularly to the local community about the Purbeck project.
Our Futures Group has been analysing the services we currently have and looking at those we could commission. Our Reference Group has been commenting on those proposals.
You said, we did.
The best way to look at a virtual ward is probably looking at a normal ward with its staff and its patients, but it's not in a hospital building, it's actually in a community. And the patient's bed, in fact, is his own bed in his own home. The job of the GP is to find patients who are most suited to this ward, so that the team, who are the staff of the ward, can deliver an enhanced package of care to keep the patients in their own home and prevent a hospital admission.
Your NHS, your voice.
said, we did.
In April and May of this year, Dorset CCG consulted with patients and healthcare professionals on a review of 15 blood glucose monitoring meters. The aim of the review was to produce a recommended shortlist of 4 meters. We held 3 public events and an online survey to capture feedback. The results of the consultation were reviewed and we were able to identify the 4 most popular and fit for purpose monitors, which were included in new guidelines for healthcare professionals.
Your NHS, your voice.
We knew from the start that new families might find it hard to be part of traditional methods of engagement, so we wanted to create ways for them to be involved that would be accessible to them. So we did that by tapping into networks that they were already part of, such as through a Facebook page which has opinion polls and links to online surveys on it.
We interviewed a young mum who told us about issues of anxiety and depression that she'd had post-birth. We anonymised that story and with her permission shared it with a group of staff who were actually looking at developing the commissioning strategy for fertility services. And every midwife, every health visitor, every member of staff that was in that room was completely focused on why we were there.
We've also put a poll on the Facebook page asking other families what their experience of their emotional health was. So that allows us to build a picture not based just on one person, but also on the other families in Dorset.
It's funny because you think you're the only one going through that, but when you come to sort of a group like this, you realise that a lot of other mums are having the same problems. To have somebody asking you, how was it for you and what can we do to improve the service is really sort of amazing, I think.
We've actually seen that when we say things to the CCG, to the NHS, to our local councils, that they actually do reflect it back in their policies. So we're really confident that what's been said today is going to be carried forward.